My name is Paul. I'm a patient of Baptist Community Health. I was living in Baton Rouge, found out I had end-stage liver disease, moved over here and was looking for a primary care provider. Honestly, was just looking around to see who my insurance covered and came across Dr. Hannah Pounds.
As Christians, we think about healthcare in regard to physical problems, but also consider the whole person. Scripture is filled with examples of Jesus caring for the whole person and commanding us to do the same. In 2014, I was able to join the work God had already started through our local churches in the New Orleans Baptist Association to launch Baptist Community Health Services.
I've been sober at that point for about 3 months coming out of the hospital, and she mentioned one of her patients was affiliated with a program called Celebrate Recovery.
My name is Derek Schubert, and I am a patient at BCHS, and I am a leader at Celebrate Recovery. Through my visits with Dr. Hannah, we talk, and I'm very open about my faith and my recovery. When I started sharing, I gave her my number and said, hey, if anybody's in need, please reach out.
Every day in New Orleans, we hear about violence and crime. But as New Orleanians, we see that there's so much below the surface. There are root issues like poverty and trauma. When you grow up in poverty or in the aftermath of a disaster, research shows this often results in mental health issues. In fact, children in New Orleans experience rates of PTSD that are 4 times higher than the national average, and 53% of our children have experienced the murder of someone close to them. Mental health problems are real. And as believers, we know there's an even deeper spiritual issue in our city.
She connected me with Derek, who then brought me to a Celebrate Recovery meeting, then eventually church, and I became a member of the church, baptized about a month or so ago, and it's a great church. I do Celebrate Recovery every week. They're my family, and Dr. Pounds has become part of my family.
That is why we at BCHS take our integrated healthcare model so seriously. But we can't do it alone. We need the church. We need your grief groups and your Celebrate Recoveries, your English as a second language initiatives, and your children's programs. We need your loving communities.
BCHS has partnered with me, and I've been blessed to actually be the middleman between the medical side and the faith side. But I get to see these men that are hurting and that have these times in the darkness, and they get to find God and they meet Jesus, and their life changes dramatically.
Having a holistic approach to healthcare, spirituality, and medicine has helped a great deal. And my faith has helped me through some difficult circumstances with a lot of questions I had, but also has improved my health and mental condition. Giving me more hope. Being well spiritually also can make you well physically.
We at BCHS want to start a tradition through Hope for Health Sunday where we focus on God's plan for the body, mind, and soul of every person in our city. Here are 3 things that you can do right now. Number 1, pray. We all know our city needs help. Number 2, stay informed, because complex problems require complex solutions. And number 3, join a community of people seeking a holistic approach to caring for those around us, because we know that it is through community that we see transformation and lives changed with the hope of Christ. On the back of your handout, there's a QR code. If you would scan that and put in your email address, this will allow us to provide you with ways to pray and stay informed about our work. Thank you for joining with us as together we work to embrace God's plan for the body, mind, and soul of our communities.